So the original cause of pain resulting in the severe acute onset lameness may not be as catastrophic as perhaps was first thought based on the severity of the initial clinical signs. This horse had a sudden onset non-weight bearing lameness whilst performing a dressage test, at which time there were no localizing clinical signs. Within 18 hours, the horse had improved substantially, but low-grade lameness persisted. And that lameness was subsequently localized to the fetlock region. And although the radiological signs were extremely subtle, we can see a very ill-defined lucent area in the sagittal groove of the proximal phalanx on the far left. On MR images, we saw substantial evidence of bone pathology involving not only the sagittal groove of the proximal phalanx, but also the dorsoproximal aspect of the sagittal ridge region of the third metacarpal bone. So we're faced with this horse which is severely lame and we don't know what's going on. We need to provide intravenous analgesia and, if necessary, sedation. We need to consider whether or not there would be any benefit in supporting the limb, for example, with a Robert Jones bandage. But we also have to bear in mind that by application of such a bandage, we could potentially restrict the development of any soft tissue swelling, which may otherwise have facilitated diagnosis. If, based on your clinical evaluation, exertional rhabdomyolysis is suspected, then we also need to consider the use of intravenous fluid therapy. You need to know how to properly apply a Robert Jones bandage, and you need to have adequate materials to do so. It's beyond the scope of this talk to discuss this further, but please refer to a suitable textbook. Bearing in mind that it is important to do no harm. An excessively tight bandage or a bandage with inadequate padding may result in severe cellulitis, skin necrosis, and skin sloughs. The photograph on the left is 3 weeks after removal of a Robert Jones bandage which had been applied too tightly. When the bandage was removed, large areas of skin completely fell off, exposing very raw, angry-looking tissue. You also need to consider at what stage is it either necessary or advisable to refer to a clinic facility for further investigation or consult the experience and knowledge of somebody who is a specialist. But this is going to depend on a number of factors, not the least budgetary constraints of the owner. Also, where the incident occurred and the location of an appropriate clinic or specialist. Is the horse in a suitable condition that from a welfare perspective, it can be safely transferred to a clinic if the nearest clinic is 50 kilometers away? You need to ask yourself, what can I potentially achieve by radiography and ultrasonography in the field? And at what stage is it best to do it, bearing in mind that it may need to be repeated?